I see it.
All right. So everyone, thanks for joining us. Just a quick introduction to Marco Nunez. He was the head athletic trainer for the LA Lakers, 2016-2019. Responsibilities included hardworking. Of course, you're hardworking, Marco. Sorry, I'm hearing a delay on myself. Give me one.
If you have YouTube opened up, you're gonna hear yourself. So
should I turn off the YouTube?
You can just close out and it'll stay live.
It will. Okay.
Yep. Just like exit it.
Okay. Is it still on?
Yep.
Okay. Sorry about that. Okay. So yeah, Marco is working hard. Included working hand in hand with the training staff, strength and conditioning staff, coaching staff, and front office to ensure highest level of on-court performance. Marco is an LA native in charge of year-round oversight of the care, prevention, and treatment of injuries of the players on the roster. I was also chiefly responsible for player rehab programs and emergency on-court procedures. Prior to being head athletic trainer, Marco spent 8 years as assistant athletic trainer and assistant strength and conditioning specialist for the team. He was an integral part of the sports medicine staff, helping to win NBA championships in his first 2 seasons, 2009 and 2010, which they actually replayed that championship game a few weeks ago.
They did?
Yeah, he did. Yeah, and I saw you in the celebratory jumping up and down after. Marco has also served as a head athletic trainer for the 2018 NBA All-Star Game and assistant athletic trainer for the 2011 NBA All-Star Game in Los Angeles. Prior to being with the Lakers, he was the head athletic trainers for the D-League affiliate, the LA Defenders, now the South Bay Lakers, beginning with their inaugural season of 2006-2007. And you were also assistant athletic trainer for LA Avengers, or Arena Football, like 1999-2003. Today, Marco consults for the Stride Performance of sports science wearable technological gear that allows to monitor an athlete's mechanical load, muscular balance, and heart rate during training, practice, and games to help decrease the risk of injury and monitor athletes' progression. His role as a high-performance athletic trainer is to develop preventive assessment protocols, monitor athletes' workload, and develop continuous education program for athletic trainers, physical therapists, and performance coaches. In addition to that, he was also a performance athletic trainer for Game Changing Films, a film company that choreographs sports scenes during movies and TV shows. Graduate of Cal Poly Pomona with a BS Kinesiology, emphasizing sports medicine, and went on to receive his MS in biomechanics at AT Still. Holds an NSCA strength and conditioning specialist and corrective exercise specialist, performance enhancement specialist from NASM. So I'm going to hand it off to Marco. Where are you at? There you are.
I'm here.
All right. So if you guys have any questions, you can just add it to the chat.
Yeah.
And then we will go through questions after our discussion.
Yeah, so I mean, I think when Arlene asked me to come up here and talk to you guys, I don't have any specific agenda, so to speak, to kind of bring up or talk about it. I didn't really do a presentation. I think I spoke to Arlene's students a few days ago. I had a full presentation, but I kind of wanted to make it more like just a discussion, a Q&A, answer any questions you guys might have, and also maybe just pick you guys' brains at the same time. You know, one of my major concerns, and I guess also maybe kind of hear from you guys, is I know as the pandemic is kind of, I don't want to say if it's coming to an end yet, but as businesses are starting to open and people are kind of somewhat going back to normal life, so to speak, one of the biggest concerns I think that I have, and I think a lot of people have, is just injuries, either soft tissue injuries, acute injuries that are going to probably occur. I have a good friend of mine that I work with. He was a fellow with when I was with the Lakers. And, you know, he and I were talking, and he had mentioned, hey, you know, Marco, I was actually thinking of opening up my own practice. He's an orthopedic surgeon, and he's working at the hospital right now. And right before the pandemic or the COVID-19, everything closed down, He's like, I was ready to open up my own practice, but I'm glad I didn't, because the pandemic, I would have been kind of already out of business. And he and I were somewhat joking about it, but at the same time being realistic that, hey, you know what, you may still want to open up your clinic as soon as this pandemic's over, because odds are there's going to be a huge amount of injuries that are going to probably be developing or occurring as people are kind of going back to their daily lifestyles, to their sports, their weekend warrior things, their fitness, anything of that sort. And I think Arlene and I were talking the other day that, I get it. It's been about 6-8 weeks that people haven't really done their normal routine, and you've either lost some weight, you've lost some muscle, you probably gained some weight, and now everybody's really concerned about, hey, I want to get back to where I was before this whole pandemic occurred. Trust me, I am the same thing. I'm trying to kind of work out in my garage and try to kind of just keep what I had before and not lose what I had, type of thing. But at the same time, I'm trying to stay realistic. Hey, it is what it is. I know, as soon as the gym opens up and I go and start doing my squats and my lunges, my RDLs and all that stuff, and I don't expect it to be the same. I don't think it's realistic for me to think, hey, as soon as I go back, it's going to be the same. Because I think if you try to regain those as quickly as possible, I think that's where the injuries are going to start occurring. And we're human beings, and even as athletes, one of the words that I was kind of throw out there and everybody knows is that your body's going to compensate. Every time I work with an athlete or even a young athlete, whoever it is or individual, if you ask them to do 10 reps of a specific exercise, whether it's a squat or whatever it is, odds are that they're going to give you those 10 reps. But what happens is that at what point is it good quality reps, and at what point are they starting to compensate? So every time I work with athletes, I always have certain rules with them. And one of the rules that I always tell them is that I'm looking for quality exercises or quality reps. I don't care if I ask you to do 12 and you only give me 3 quality ones. If the 4th or 5th one I see that the quality is poor and you're compensating, we're stopping and we're done there. And oftentimes, they kind of get frustrated, like, Marco, but I can do it. I'm like, yes, I know you can do it, but you're not doing it correctly. And now you're compensating. Now you're going to end up with something issue that I'm going to have to deal with, and I don't want to deal with, type of thing. At the end of the day. So, in some of the areas, like right now, when people have talked to a bunch of people over Zoom and webinar, stuff like that, and they've always said, well, what should I be, what should I have been working on? What should I be working on while I'm at home? I don't have the weights. I don't have the dumbbells. All I have, these 15 pounds, stuff like that. And I said, that's fine. That's all. That's great. But some of the areas that either, you can always do or you can focus on, there's 4 areas you can always focus on. Mobility is always something you can do. You don't need any weights. You can have some bands. Sometimes you don't even have any bands. Stability is the other area that you can always concentrate on. It doesn't really matter what you do. Proprioception is another key area you can definitely work on. Both concentric proprioception, eccentric stability, eccentric proprioception. Everybody has a chair at home. Probably everybody has a step. You have a curb. I'm sure most places have a curbside. You can go out there and kind of do a little plyometric eccentric loading. And then the last one you could probably do to the cost of home, which is a volume. Work on the amount of volume that you're doing, whether it's either jogging in place, running in place, jumps, lateral jumps, box jumps, whatever you name it. They have chairs. So those are the 4 areas that I think is everybody could focus on, should be focusing on as far as athletes. Because as soon as you go back, as long as you have the mobility, the stability, the proprioception and the volume to be able to do it, you're ahead of most people, and you can actually start maybe perhaps progressing. But if you don't have the mobility to do any type of exercise, or you lack in the mobility, or more importantly, the stability, that's where you're going to get into areas, and that's where you're going to start compensating, and that's where you're going to start seeing the low back pains, low back issues, the patella tendonitis issues. It may be some bicep tendonitis issues in your shoulder type of thing from doing the military press, or trying to do too much, forehead stuff, hamstring issues, hamstring tightness, hip flexor issues, hip flexor tightness from doing those RDLs, because you want to try to get right back where you were at. So feel free to jump in if you guys have any questions. Either go on the chat, or either just unmute yourself. I'm fine with doing that, and then kind of just ask the question. I'd rather either see if I hear it from you guys versus going on the chat. So having said that, I think somebody had jumped in right before we started doing the recording about some of the volume, or doing some of the more low intensity, high rep type of exercise or movements. And doing those are also great, but at the same time, you also kind of want to look at the quality as far as how much volume, how much movement are you doing, how much exercises. There's been some times where I've gotten athletes where they come into, I see them and I evaluate them. And I think I was just recently, there was a collegiate athlete about a month ago. She was complaining of some low back issues. And, she mentioned, hey, every time I squat, I always have low back issues or soreness the next day. And she's like, I don't even squat that much, Marco. It's just very light. So I asked her to show me how she squats, even with no weight whatsoever. Right off the bat, with no weight, I can also already see that she was already compensating in her movement. She was shifting her body. She had valgus in one of her knees. She had poor hip flexion in the area of stabilization. And then at the, when I told us, hey, you know what? To be honest with you, you shouldn't be squatting with any weight whatsoever right now, because you are compensating so much that whatever weight that you're adding to you, your body's compensating, and that's why all that load is kind of going to your low back. The analogy that I always use to when I talk to people is that if you take a piece of steak and you bend the steak, it's going to break somewhere because all the tension kind of goes into that area. And most people, majority of times, like, okay, well, the steak broke here, let's go and tape it up, let's go heal it, let's get crazy glue, let's get whatever you want because we want to fix this area here. But not until you fix what's causing that break in the middle, which is oftentimes is a tension that's occurring in the back. Once you start releasing it, that break that's going to be occurring is going to be going over and over and over again, and you're never going to fix it. Every time I work with individuals, they'll come to me and hey, there was a gentleman that I was working with. He had a shoulder issue. He was a swimmer and he complained of pain in his shoulder. I didn't even touch the shoulder. I worked on the muscles surrounding, like the rhomboids, the lower traps, the release of the pectoralis major, the teres minor type areas, because that was causing the tension in the shoulder. And right away, he's like, hey, I have full range of motion. Now I have less pain whatsoever. It's like, you didn't even touch the shoulder because the shoulder wasn't the issue. The shoulder was the result of the issue that you're having. And that's what happens oftentimes when you're exercising or you're compensating. And that's one of the issues, I think, that as we come out of this pandemic and we kind of go back to normal life, whether exercises, whether sports, I'm concerned and worried, and I think a lot of people are, is that we're going to start seeing a lot of those issues. So the big question is I think most of you guys, or some of you guys are either trainers or personal trainers or strength coaches, part of NELA, is trying to figure out how to incorporate that into your programs and hopefully prevent some of the injuries, especially the compensation injuries. And I think more importantly is how to communicate with your clients that, hey, we're not going to be lifting, your first day back, we're not going to be lifting the same that you were when I saw you 6 weeks ago, because that's one of the issues that I always have working with athletes. Athletes are type A personalities. Oftentimes I'm always trying to tell them no or slow down. One of the things that I always tell them is that, hey, I heard it one time, the evil of good is better. Just because you feel good, sometimes athletes will, hey, I feel good, let me do more because I want to get better. But no, if you feel good, let's stay good. Why mess with it? Come back tomorrow, let's see how you react, and then we can kind of progress you from that part. So I think one of those that are on here that kind of are certified trainers that work at NELA, one of your big issues is going to probably be to try to slow down your clients and explain to them, hey, this is, like I said, it's a marathon. It's not a sprint. We'll get you to where you were before the whole pandemic. Don't worry about it, but we got to get you there safely as possible. Otherwise, if you get hurt or you get injured, you won't be coming to the gym. Like I tell athletes a lot of times, sometimes they don't want to work on mobility or stability wise or the proprioception. At the end of the day, when you're hurt and you're on the sideline and you're not participating in the game, no one cares that you were able to squat 400 pounds. Nobody cares that you were able to bench 250 pounds. Nobody cares that you were able to do a deadlift of 300 pounds. You're sitting there. You're not contributing. You're not helpful. Those 300 pounds of deadlift of squats that you're doing because you're injured yourself, it doesn't help. It doesn't do anything. An ankle sprain, an inverted ankle sprain, a tendonitis, something like that, or a torn hamstring, they don't care. So it's all about mobility, stability, and gradually kind of get you to where you're trying to go be back. I know it's oftentimes frustrating for a lot of athletes, and I imagine everybody that's in the gym is those type A personalities. Trust me, I'm a type A personality. I just want to kind of get it done, get going, get moving, and it's very hard for type A personalities people to kind of just slow down a little bit, work on the corrective movements, on the mobility, on the myofascial release, which sometimes formal. Even when I do formal, sometimes I have a habit that I just go right through it. Come on, let's go, because everybody wants to get that sweat. Everybody wants to get that exercise. Everybody wants to, see those bulgy muscles. They want to see that waist going down. They want to see all the results right away that people think that's going to be happening from working out, which it does. But like I said, if you get hurt from working out and then now you can't go to the gym, now you're at home, now all those results that you're going to try to get are kind of pointless, so to speak.
I have a
Yep.
question.
Yep.
Like when you're starting, when the players were starting to come back after their break, did you have to deal a lot with that? Like players who did not work out during the break and then they're coming in wanting to go full force or?
Right. So we've always dealt with either one or the other, and you know, over the years, players started getting better and better. At least the veterans. It was always an issue with the young ones that didn't understand that, hey, I need to take care of my body now as I'm young. You know, people, especially when they're young, they're so used to, hey, they're able to get out of bed and just go play basketball, go play baseball. As the older you get, you lose that flexibility, the mobility, time to speak. So you kind of work on it. But every time players, when the season would begin or when players would return to us, what we would do a whole battery of tests right off the bat before they lifted anything, before they got on the court. And what I would do is I would shoot them a text like a month ahead of time or 2 months also ahead of time. Hey, don't forget, when you come back, we're going to test you. Don't forget, when you come back, you got to get tested. So before they can even touch a basketball, before they can touch a weight, we would have run them through a whole battery of tests, and it would be something similar like the FMS, SFMA, plyometrics, eccentric loading, mobility, movement, stability in the knee, all those areas, and see where they were at. And then based on the information that we were able to gather and where their value or their percentage of high risk, that would determine where they would start first. There'd be some athletes that, hey, you know what, you're such a high risk right now because you haven't done anything. Sorry, dude, you're not touching the court for another month. You got to stick in the training room and you got to stick on the weight room. Maybe I'll compromise. You can maybe do some free throws if you want, but other than that, there's no movement on the court because now you're putting yourself at high risk. And if that does happen, sometimes they'll go ahead and start complaining of patellar tendonitis. And the weird thing about it is that all I can do is control what they do in our training room or in our environment. When they go somewhere else, unfortunately, I can't control it. But it wasn't something that, you know, that they would we would be able to keep from me because, you know, 2-3 days later, they'll come in complaining of patellar tendonitis. They'll be complaining of hip flexor tendonitis. And I was like, hey, you haven't been on the court. Obviously, you're doing something else out of this area that you weren't supposed to be doing. And then they finally went to me and said, yeah, you know, I've been playing pickup games. Well, this is the result why, and this is the reason why we were trying to prevent you from getting in the court, because we knew this was going to happen. And then once we educate him, then they're like, okay, fine. You know, then they'll start listening to us, and then we'll kind of start the process all over again with them. Thankfully, they didn't. You know, most of the time they didn't. There wasn't a major injury like a season-ending injury or like a prolonged injury that was going to keep them out for about 6 to 8 weeks.
So Stacy has a question. There are
Yes.
so many books and videos out there explaining form and advice. What books or videos explain mobility, stability, proprioception, and volume that you would recommend?
Ooh, I would probably have to resort back to my Cal Poly books once. Okay. I got to go back and kind of find out which ones are probably some of the best ones that I have. I got to look at my library. And then maybe what I do, I'll send you a list or shoot over a list to Arlene specifically on those, and then maybe you can kind of shoot it over to them. But it's a matter of evaluating and increasing mobility starting from your feet. I think one of the classes that I spoke to with Arlene the other day, the students showed the difference between what's considered mobility and stability, and be able to understand what joint is considered a mobile joint and which joint is considered a stable joint. Once you understand those areas, then you can kind of focus on stability and mobility, or improving mobility and stability in those specific areas. For example, the foot is considered a stable joint or stability, but the ankle is more of a mobile joint, just like when you squat. Oftentimes when people can perform a full squat, odds are is that they have poor mobility in their ankle and they probably lack a lot of dorsiflexion in that area. So that you want to kind of focus on improving dorsiflexion. There's plenty of exercises you can do with band, no band, to try to improve the dorsiflexion mobility in your ankle before you kind of squat. You know, with the Lakers, when the athletes come in, before they do any specific weights, they have to go through a whole mobility and stability routine before they're allowed to go ahead and do their squats, before they're allowed to do their RDLs, their bridges, or anything of the exercises. They have to go through their specialized, individualized mobility and stability routine before they do anything else. Prior to the games, one of the big issues, or one of the areas that we kind of focus on is, as we call activation, isn't necessarily trying to get them stronger before the game, but make sure that they have that mobility and stability in those joints to try to reduce and prevent any injuries that may occur while they're playing. Such as, you know, if we have a player that has a history of poor dorsiflexion in the ankle, we're going to focus on that. If we have a player that has poor stability in the knee. We're going to focus on kind of just activating the glute, make sure that the glutes will activate it both concentrically and more importantly, eccentrically, to make sure that the knee is stable and is being supported. So when they're landing from an eccentric jump, the knee is stabilized and reduces any type of injury like an ACL to the knee, and patella or quad tendonitis to the knee.
Okay. Does anybody else have any other questions? I think, Paul, you had a question about.
You can either go on the text or I'm fine if you guys want to unmute it and just speak up.
I'm going to unmute. It's too hard for me to type it. But my question, Christine asked before, like, hey, we need to go into early small weights to start before we get our members back in as a coach. And Coach Arlene and I have talked in depth about, you know, potentially doing a training camp. And what the plan is similar to pro. Why not follow a pro sport mechanism? These guys are great. They already know the answers to it. I played college sports. I understand the reasons for it. We have a lot of members who have been very active and doing high volume, doing a lot of the stuff that you talked about already. Mobility being the biggest issue, I would say, for the majority of our athletes. So us getting back in, is there something we can do to prepare them before they come back that you think would be the best thing for them? If they're already doing high volume and, you know, their stabilization is
correct.
We could probably improve on that too.
Yeah, no, you can definitely do, even before you get into the weights, one of the areas you can definitely use, and like I say, I prefer either no weights, is using band work. That's very great. That's very popular. You get great both, and the great thing about the band work is that it forces you to do the concentric motion, but more importantly, the eccentric motion, because you got the control from the band kind of resisting and pulling you back. As far as your members are starting to return or hopefully returning in the next 2 or 3 weeks, either creating a care package for all of them, sending them something with a couple of bands, and it's just 1 or 2 bands. The lighter, you know, the lighter the color of the band usually tends to be lighter. The darker the band tends to be a little heavier. But a nice little kind of care package for your members with the band work, and then an array of exercises, you know, focusing on the quads, hamstrings, because they can do all these same motions. Even with the young athletes, you know, doing band work alone without even having to do any of the weight works. It's even better for prevention of some of the injuries than actually doing the weight specifically. Because what this does, for example, something simple as a monster walk. I don't know if you guys are familiar with the monster walk, where you put a band in there. What that does, it forces you, when you do whichever direction that you're moving, you're working on both the concentric on one leg, or now you're working on the eccentric motion on the other leg at the same time. So now you're working the kinetic chain all together. I've always been a big proponent of focusing on the kinetic chain, just because I've worked from working with athletes. And I guess that's the other question also when you have members, and I think I did a post on one of my Instagrams, is you got to decide whether you're working out for the aesthetic look or for the athletic look. And I think that's one thing that you as members or individuals need to decide, okay, am I working out for aesthetic? And if it's for aesthetic, then yeah, by all means, then do your weights because you want to look pretty, you're doing the mirror work, and that's fine. But I've always been focused on the athletic portion of it because that's what I've always worked with. And even when I work out for myself, I'm more focused on the athletic because I know as I get older, those are the issues. What I'm trying to do now is beat Father Time like everybody else is doing. So I'm working more towards the athletic than the aesthetic. The aesthetic will be nice because you look great and stuff like that. But sometimes the athletic, because as you get older, the mobility and the functional mobility is one thing it's a huge component.
If I can just share that screen that Marco was speaking about earlier.
Oh, there you go. Oh, you got it.
Yeah.
Okay.
Just disregard the little box there, but this is, you can explain what this is.
Yeah, so this is kind of just a quick breakdown whenever you're working with your members, or if you're trying to work yourself and you're trying to figure out, okay, what areas am I going to be working on improving mobility and stability? And this is kind of quick, easy breakdown of what's considered mobility and what's considered stability. So normally we'll start at the bottom. The foot, not the ankle. Keep in mind, the foot is considered a stability joint. Okay, that's when you see someone does a squat and you see the toes kind of start moving back and forth, side to side, because they either have lack of stability or their body's trying to kind of sustain stability. The ankle itself is considered a mobile joint, a mobility joint. So like when you squat or someone has the inability to fully do a squat, odds are is that they have poor mobility in their ankle. So you want to kind of improve the dorsiflexion in their ankle. The knee is considered a stability joint just from landing. Every time you see a player, 99% of the time when you see a player have an ACL injury or an MCL injury while they're playing sports, you'll see the knee kind of, when they land from the knee or they change direction, you see the knee land. And then you see the knee go what's called into a valgus stretch. Basically, the knee kind of caves in or the tibia internally rotates. And then that's where they tear their ACL. Now, the stability for the knee doesn't necessarily come from the knee, but it comes from the muscles that are associated to the knee. And those muscles are primarily in the pelvis area, which are pretty much your gluteus maximus, your gluteus medius, your TFL, kind of all your hamstring muscles in that area, the ones that kind of sustain the stability in your knee. So if you have a member, when they squat and you're observing them and you see one of their knees kind of caves in completely, then the other one, odds are that side is very weak and they're compensating on the strong side to perform the squat, and you need to work on their stability and preferably do more unilateral exercises than bilateral exercises. The next one is the hip, the mobility. The hip is one of the areas that you want to work on mobility-wise. The lumbar spine, AKA the core, so to speak, is known as the stability area. The thoracic area then would be the mobility. The scapulothoracic, which is right below the neck, is the stability. And then above, as far as for the cervical, kind of like the C1 through C7 spine, is considered mobility.
All right, does anybody else have any questions? Omar,
Any
love
questions?
the picture.
I do. I'm not sure if this is the right question for you or not.
Okay.
I'm 50. I've had a lot of things that have really sapped my energy, and it's been frustrating because I do yoga, I do circus stuff, and I've run out of stamina. And and part of me sort of daydreams sometimes of like taking crazy cool supplements as a way to help me stay strong and have more stamina. Is that something you feel knowledgeable in, or would you have other tips besides the obvious?
Yeah, you know what? It's one of the things I always talk to people about when they tell me, hey, sometimes I don't feel energy, or sometimes I feel like daisical or something like that. Are you guys familiar with what's referred to chronotypes?
Yes, about like if you're a wolf or a whatever.
Correct.
Yeah.
Exactly. So one of the things either with athletes and individuals, I always try to identify what is their chronotype. Oftentimes, it's a matter of trying to find out when you feel you're going to be more productive, when you feel you're going to have more energy, and that's when you're going to work out. So whenever I work with somebody, one of the goals I tend to do is say, hey, I got to find out what your chronotype is. So when we're going to schedule a workout, I want to schedule it when you have the most energy. What time is your kind of what's called your circadian rhythm is located in, and then we schedule your appointment during those specific times because I feel I get the most output, the most energy from that individual. They're more energetic, they're more receptive, they get the job done, they come in, they get it done, and then what happens is that what you'll find out is that when you do it during that time, you'll tend to have more energy during the other times that you feel that you normally don't. So finding out what we refer to as a chronotype of each individual is one of the things that I always kind of focus on, especially when I get a question just like what you mentioned right now. I got to find out what is your chronotype. Then we kind of go based on what the individual is. The other area also is either kind of your nutrition and your eating habits and what you're eating. I know everybody's is different. You know, everybody asks, well, what diet should I use? And I hate to prescribe specific diets because everybody's individualized. What would work for one individual doesn't work for the other individual. One of the things I always try to start with is try to find out what are your deficiencies in. You know, every time people do a blood work on a yearly basis, find out what are your deficiencies, where are you deficient, and let's just start with those deficiencies and focus on those areas first. And sometimes that in itself will kind of resolve some of the energy or the lack of energy. And people are surprised, oh, that's all I needed type of thing. But I know a lot of people, trust me, I've done the same thing. Where a couple of years ago, I felt like, what's going on? Am I going to some kind of midlife crisis? Why am I this? I want to go do like blood work. Am I, my stomach just start? I was ready to start taking testosterone pills and you name it. But it was just something as far as, what am I deficient in? And then also trying to figure out what's my chronotype, and then working within my chronotype environment, and it kind of helped me out.
Cool. Thank you. I'm going to look into all that. I've got a doctor physical coming up. I'll see if she'll test some of that stuff.
Perfect.
Yeah, thank you.
No problem.
I have a comment. slash question. So, so one of the coaches at the box, and during warm up and during stretch, you know, we have some mobility work that we try to implement, and we get a lot of members who resist that. It hurts too much, you know, and understanding the difference between pain and lack of mobility.
Right.
So how do you talk to athletes who have that kind of like mentality? Like, you know, I think the person who comes to mind is like Tony, you know, one of our members. He's very strong, but, you know, mobility wise. So how do you talk to a member or an athlete who comes to you with that?
So, you know, when it comes to, let's start with the warm up. You have to kind of identify the type of warm up that you want to do with the individuals and what your goal is. So there's both referred to as a static warm up and a dynamic warm up, right? The static warm up is everybody just sitting down, you start stretching, boom, boom, stuff like that. Dynamic warm up is kind of you get up and kind of move around. So it depends on what you're trying to accomplish. And there's been plenty of studies done on both the dynamic warm-up and the static warm-up, where the static, if your goal is to try to increase flexibility and just flexibility alone, then you want to focus on a static warm-up, because there's been plenty of studies that the static warm-up helps increase flexibility in the muscle. But if you're trying to increase performance, which this is kind of the angle that I take as far as, hey, you want to run quicker, you want to get better, then you want to do a dynamic warm-up before any type of activity, because there's been plenty of studies that a dynamic warm-up actually increases performance, helps athletes run faster, jump higher, and all that stuff. And I can send you some of these studies if you want to kind of read them and go over to them. So let me make a note regarding, and I think I did a webinar like 2 months ago specifically on the dynamic warm-up and the static warm-ups. So, you know, the funny thing about it sometimes is, and this is what you can do, there's been some occasions where I've gotten some parents and they bring their kids to me and they want to say, hey, you know what, my son wants to increase vertical jump, and, you know, what should they be doing? Should they be doing power exercises, box jumps, you know, compound, all that stuff, and anything like that. And right away, you know, when I talk to them, I'm like, you know what, I can probably, and I do, I can most likely increase your vertical right now by at least 1 inch or 2 inches with no exercises whatsoever. And they're like, oh, what do you mean? So I have them jump, and I have the vertex, and they jump, we measure it. And then what I do, I get them on the massage table, and I start doing hip releases, iliopsoas releases, quad releases in that area. And you'll be surprised, because so many people, their hip flexors are so tight that they don't get that full extension. And after I do that, I have the athlete or the athlete jump again, and easily they'll increase their vertical by 1 inch or 2 inches just by doing some of the mobility or some of the myofascial releases. And at first they're like, oh, wow, okay, so that does help. And we didn't even do a single form of exercises. So they're both related. If you lack the mobility in your body, you're not going to be able to perform and do that proper squat. So something simple is like, hey, somebody's trying to squat, increase the squat. If they don't have the mobility of the ankle, they may slow down or they may plateau, and they may not be able to do that full squat or get stronger because they lack the mobility in their ankles. So they're both related, and there's no way that you can separate them. That help? Okay, good.
But I would love those articles. If you
I will. I'll send you that. I'll send them to Arlene.
Okay.
Okay.
I'm going to jump on one more question with that.
Sure.
Dynamic static. Is there something that you encourage? We have our philosophy with it, but what do you encourage for getting started and warmed up quickly and efficiently?
If I had to choose one or the other, it's always been a dynamic warm up to try to get the athletes going. One, it obviously gets the blood flow going. You get both the elasticity in the muscles. Athletes, individuals in general, they like they're type A personality. They like to move. Many people do not like to just lay there and sit there, unless it's more. I may use the static stretching technique more as a recovery post-wise, because at that time, then they're tired and hey, I just want to kind of lay here and sit here. Then that's a perfect time to use it as far as kind of like as a recovery stretch. But prior to that, I imagine 95% of your individuals are that go to a gym are type A personalities. All they want to do, they want to get moving. So the dynamic warm up, by all means, if you have to choose one or the other, you got to go dynamic.
All right, question. Stacy,
Oh.
after a workout, how should the cool down be? Would you stretch, static, and foam roll?
Okay, so I would, yes, so I would definitely do, I think that was one of the questions. I would do a static and a foam roll, but keep in mind that you want to foam roll first before you do any type of stretching. And the analogy that I use is, imagine if you have a water hose, right? And you want to try to take the water hose and kind of go ahead and water your flowers, and your flowers are like maybe, 10, 20 feet away. And if your hose is all tangled up, and no matter how much you pull, I don't care how much you pull, that hose is not going anywhere, okay? And your tangled hose is kind of pretty much all your fascia and your muscles that get tight after your workout and fatigue. So you want to foam roll first to try to untangle the hose, so to speak, untangle the fascia. Then you can go ahead and do the flexibility and do the stretching, because otherwise, if you do the stretching before you do the foam roll, you're going to stretch to the cows come home, and you're really not going to see much increase in elasticity in the muscle unless you foam roll first.
Follow up on that. What about foam rolling pre-workout or pre-warm-up?
Same thing. So what we do is do a foam rolling before the activity, and then we'll do a dynamic stretch before the activity, post activity, foam roll, and then a static stretch.
All right, question from David. Often basketball players wear ankle braces to protect the talocrural joint complex from a prior injury. In terms of rehab from an ankle injury, would you focus more on strengthening muscles, triceps uri group, and ankle proprioception, as opposed to using ankle braces to reduce the stress on the knees? Sounds like a SNC student to me.
Okay. So, lately there's been a question, tape or not to tape, so to speak, or to wear a brace or not to wear the brace, okay? So yes and no. So it all depends on the situation and the case scenario. So for example, if I have an athlete that has never had an ankle sprain, or maybe has had one occurrent ankle sprain, or maybe 2 mild ankle braces here and there throughout their career, I would prefer not to use an ankle brace or tape, but focus on strengthening the ankle or the proprioception in the area, strengthening the glute, because the glutes are the ones also help stabilize the ankle. There's been plenty of studies over the last 5 years that the glute not only stabilizes the knee, but because of the kinetic chain, it also stabilizes the ankle, because when the knee kind of caves in, goes into valgus, then therefore the foot goes into a pronation. And what it does is stresses the stabilizing muscles in the foot, which are the peroneus longus and the tibialis anterior. When those start fatiguing, then that's when you get what's referred to a chronic ankle instability. So if I have somebody that doesn't have recurrent ankle sprains, not a huge history, maybe 1 or 2 here and there, my goal is to, hey, we're going to strengthen those ankles, we're going to strengthen those proprioceptors and kind of get you going. Now, if I have somebody that just came back from an acute ankle sprain, they just had one, they're returning to play. Now I know that there's a huge instability in that ankle, so they're at a higher risk of spraining in the ankle, then yes, at that time, I will definitely put them on an ankle brace. I would definitely tape them up but the eventual goal is to slowly progress them out of that ankle brace and out of that taping. Now, depending on the time of the season, when it occurs, they may have to wear the ankle brace the rest of the season. And then during the off season, then we'll focus on kind of strengthening those muscles. Not that we won't do it during the season, but our goal is to try to get them on the court and keep them on the court. And if I have to use an ankle brace or tape them for that time being, then so be it. But at the end of the day, if you have no issues, ultimately you're trying to get them out of that ankle brace so that you can do the increase of proprioception and stuff like that. Hopefully that answered it. Okay.
All right. Anyone else?
So I've been seeing a lot of that articles about icing, to ice and not to ice. I think Arlene had brought it up as well. So I just wanted to kind of hear a little bit more about that if you have read on that.
So, so I guess there's been a lot of articles, and there's 2 topics behind it, I guess, what you're asking. There's a whole question, should you just ice just for recovery, so to speak? And then there's also the whole issue about, should you ice even after you have an injury and you swell up, okay? So we'll talk about the ankle one first. So the whole premise, when you sprain, let's say we'll take the ankle, when you sprain an ankle and you have swelling in that area, your body is naturally trying to heal itself. And that's what happens. Just like when you cut yourself and blood rushes to that area and you start kind of bleeding, the reason why it does that is because your body's trying to kind of close up the cut and using blood, and that's what it's supposed to do, which is normal. You actually want that to happen. If that doesn't happen, then that's an issue. So when you sprain an ankle, you sprain a ligament inside your joint, inside your body, the same process happens. All that oxygenated blood goes into the area and it's creating the healing process. So you want that. The downside to it is that sometimes the blood, once it's unoxygenated, the blood kind of pools in that area and it compresses against other joints, and now it doesn't allow more blood to come into the area to kind of continue healing, and that's what you don't want. So the whole concept of icing is that you create what's called a vasoconstriction to try to prevent from the swelling happening. Now, one of the things that I've realized and I've done that actually helps even more is more of what your goal is try to kind of stimulate blood flow. Yes, you want blood in that area, but you also want the unoxygenated blood to kind of get out of the area. So what you're trying to do, you want to try to create a pumping effect back and forth. So you want the blood to go back and forth. There's a lot of units. That's what a lot of people use what's referred to as I think the Normatec, the pneumatic pump, that creates that pumping effect to try to get some of that blood out of that area, but you want oxygenated blood to come in the area. There's other units, electrical stim units that you tend to use, kind of referred to as the H-wave unit, and it creates a pumping effect. One of the things that I would probably recommend a lot of people, that if you have an ankle sprain, you pretty much keep your foot elevated, but you pump your foot. Keep your foot pumping, because you get those muscles kind of activated, you get the muscles kind of pumping, and you get the blood flowing through that area. And you'll be surprised how much it'll help reduce some of the swelling just by pumping the foot. It's very common for people to, hey, I sprained my ankle, I'm not going to move it, I'm going to leave it still, but you kind of don't want to do that. It's kind of the same concept when people work out and they feel really sore the next day. One of the worst things you could do is just do nothing. Most people are like, I'm so sore, I'm going to sit here. No, you actually want to you want to get up, you want to move around, you want to do some kind of recovery workout, because you want to get the blood flowing through your system to try to get all that lactic acid blood that kind of pulled in there. And those muscles, you want to get oxygenated blood. It's the same concept when you have that, like an ankle sprain, something like that. You want to kind of create that part. Now, going back now we talk about as far as just for recovery. Yes, there's been some studies that show that, hey, it doesn't help. There's been studies that show that it does help and stuff like that. When it comes to that, at the end of the day, it's maybe more of a psychological effect. And it's one of those things, hey, if you feel great afterwards and it's going to help your performance the next day, whether it's jumping a cold tub, I'm not going to stop you. And I know with the Lakers, we had, I would always give them the option that you do a cold tub, we had a cryo chamber, you do a pneumatic pump, and you'll be surprised how some athletes, and it's the same thing. Some athletes were like, hey, you know what, the cold tub, I just don't feel anything for the cold tub, and they prefer the cryo chamber and they feel like great. And then other ones are like, hey, I don't see anything in the cryo chamber, but going to the cold tub, I'm able to tolerate and it feels great. At the end of the day, the cold tub is not going to hurt you. So as long as it doesn't hurt you and you feel some positive effects, why not?
All right, we have a question from Liz. What is your recommendation for someone that favors one leg more than the other after not having proper recovery from a broken foot or ankle surgery?
Yeah, so you see this a lot, and it's very common, especially with your ACL injuries. And this is kind of where the compensation comes in effect. So if I had somebody that does it, and I think I just got done with another Zoom right before you guys, and that's one of the questions, that if you have an individual that has lack of strength on one leg, would you still continue doing bilateral exercise like a squat? And yes, I would still continue doing bilateral exercises in the sense of a squat, but what I would focus is more on the quality of movements, because naturally, if you have more strength on one side than the other, when you do the squat, you're going to see a weight shift to whatever side is more dominant. And your goal as a strength coach or the trainer is to make sure that they stabilize. Having mirrors in every facility and doing a squat or even a squat in front of the mirrors gives the individual kind of a little feedback and let them know, hey, this is where I'm at and you want us kind of stable. The next step, obviously, is doing unilateral exercises to try to regain the strength in that one leg. And then that's how you monitor it. If you do something simple as a single leg squat or a pistol squat with a dumbbell, on one side, you'll be able to see the difference. Hey, maybe the individual may be able to do a single leg squat with a I don't know, 45-pound dumbbell on one side on the dominant leg, but maybe only be able to do 20 pounds, or maybe able to do no weight whatsoever on the undominant or the affected leg. And then that's where you want to focus doing primarily unilateral exercises. But at the same time, you want to focus doing on bilateral exercises, because when hopefully the goal is when they get the symmetrical strength in those areas, then they're right back to kind of doing symmetrical squats, versus now you have to retrain them on how to do a squat at the same time. So unilateral exercise is probably one of the best things that you want to kind of focus on and do in that area, but don't neglect the other leg, because it's very common that people just do unilateral exercise on one side and then don't do it on the other side, and then they start having issues on the other side.
Yep. All right, any other questions?
Can I shift gears on a little bittersweet moment and question on Kobe and one of the things that?
Oh yeah, but if you guys want me to ask me Laker questions, by all means, go ahead.
Oh, here
one
it
of the
comes.
things, one of the things that I really excited me
worms.
about having you on today was just your relationship with these athletes and the ability to. My favorite thing in the gym is to watch an athlete and see which movements we can improve by stabilization, or if they're rotating one side or the other. And you watching these athletes on the floor day in and day out, was there something with Kobe blowing his Achilles that you may have seen looking back, like, oh, we did too much with this? Or was it, like tension, freak accident? Yes, but also what led up to it? Or do you see anything on these athletes after the fact going, I learned a good lesson on that. This is something that I could have been better at, or just not better, just
correct
knowledge.
So, okay. So there was a presentation I did, and as a strength coach, as an athletic trainer, as a physical therapist, there's 3 areas that you look at when you're prescribing a workout or a program, whether it's, how many games you're going to play, how many minutes, whatever it is, right? And it's basically the who, the what, and the when. Basically, who am I working with? What am I going to do with them? When am I going to do with them? And out of those 3 things, the question is, which is the most important, which is the most critical when you're working? What you're going to do, when you're going to do it, or who you're working with. And at the end of the day, it's basically who you're working with, because depending on who you're working with is going to dictate what you're going to do with them and when you're going to do it with them. It kind of goes back to that the lady that asked me about the chronotype question. Okay. As a strength coach, as a personal trainer, you have to, there's a saying in sports, you have to know your personnel when you're out on the field. You know how to, but as a strength coach, athletic trainer, you also have to know your personnel, your clients, your athletes. You have to know what it makes them take and stuff like that. So as far as going back and looking at as far as Kobe in his Achilles injury, one of the things about Achilles injuries, unfortunately, is that there has been plenty of studies on it, and there's no true mechanism of injury. There's no way to predict. For example, an ACL injury, if an individual has a lot of valgus in the knee, you can say, hey, they're at high risk of an ACL injury. So when the injury occurs, like, yep, we kind of saw it. They were at 80%. We were working on it, but unfortunately, we didn't get to it, type of thing. Achilles ruptures, unfortunately, there's 0 mechanism. There's no predictors whatsoever. Yes, I know, kind of going back at it, people may say, hey, he was old, it were too many minutes, stuff like that. But at the end of the day, as what they say, the mama mentality, and I'll give you an example of the mama mentality kind of associated with that Achilles injury. Kobe's Kobe. We track our athletes. When we track the load management as far as the work, what's called their acute to chronic workload. And if a player's in the red, then we make a recommendation, try to limit their minutes or stuff like that. But at the end of the day, if it's game 7 of the finals and an athlete like Kobe is in a red, is anybody going to really go tell him, hey, you can't play? No. So it varies, and it's very important to know who your athlete is. And then a player like Kobe, and kind of those high caliber players, it's almost great to work with because they also know their body. They know when they need to shut down. They know when they keep going, and oftentimes you also get a lot of feedback from them. So working as an athletic trainer, and when I talk to student athletic trainers, the subjective part, asking all these questions and getting to know who your athlete is and getting feedback and allowing them getting feedback from your athletes or your clients is very important. And it's great. It's great when you work with somebody that knows their body, know their limits, they know what they can do. It's awesome because now there's communication back and forth. Now, going back to that injury there, I don't know how many people know as far as the rules of the game, is that when you have an injury and you're fouled and you have to go do a free throw, if you don't do the free throws and you leave the game, you're not allowed to come back into the game and you're done. Okay. So Kobe kind of having the Mamba mentality, I'm sure probably said, hey, I have to go shoot these free throws because I'm going to go back to the locker room, see what I need to do to come back into the game. And that's just kind of like who he was and what he did. And that's kind of what the Mamba mentality was all about. Everybody sees, we used to see him kind of working out hard, working in the middle of the night and late at night, being the first one and the last one leave, and that he always did that. But at the same time, his method of Mamba mentality was also trying to find out how to do something, even if he has to compensate and figure out a way how to do what he needs to do. So in that scenario, he was like, hey, I need to shoot these free throws because I'm going to go to the locker room. And realistic, obviously, he probably, hey, there may be a 0.0001 chance, but hey, if there's a chance, like, if you're telling me there's a chance, I'm going to go ahead and do it. So.
All right, wow. Christina has a question. What is your favorite Kobe memory?
Ones I can tell you, the ones I can't tell you.
Let's go off live and tell us the one you can't tell us.
I know, we'll go off. Yeah, we'll go off live. No, you know what? I think just working with him and understanding the person that he was, and more importantly, the expectations that he had for everybody. The Mamba mentality is something that he worked hard and he did it, and he expected everybody to kind of be with him or have the same philosophy, same ideology, same mentality, because he understood that it took a team to win everything. And it wasn't just expecting the high standards from his players, not his players, his teammates, but also from his coaches, from the training staff, from the strength coach staff, from the media people, from the ticket sales people. I mean, everybody understood that, and everybody understood that they had to bring their A game when he was around or when he was present, because we wanted to win, and everybody had to do their part. And I think just kind of learning that from him was something great. So now, from whenever I do something, I have our team or my team, and we need to do the same high level standards to be able to do what we want to try to do. Is there evidence to support that kinesio tape works? All right. Okay, so this kind of goes back to almost the cold tub question someone had asked me. I haven't read anything as far as whether there's evidence that it actually works. But again, at the end of the day, if I apply a kinesio tape, and trust, I have used kinesio tape, and I always use it, and I will continue using it. If I feel that the athlete helps support him in any way, it helps inhibit or activate a muscle, which I think that's some of the studies have shown, or not studies, but that's what they imply that it's supposed to do. But if the athlete, I apply it, let's say for a shoulder, and the athlete feels better, and he or she's able to do and perform at their best ability, I'm gonna keep using the kinesio tape.
All right, any other, David asked, Marco, can you please tell the story of Kobe's game in Denver, wanting a nice tub, and Kobe's boat quote?
Was that one of your students? David?
No,
okay.
No, he's not my student.
Oh, so how does David know that story?
David, how do you know that story?
I listened to your podcast with Jerry Adias.
Oh, okay, that's what.
Yeah, I thought it was an awesome story.
Yeah. So okay. So there was a story. My first year, and then also Tim DeFrancesco, our strength coach, was also kind of involved in this as well. Kobe, we get to Denver, and then I think it was our first road trip. Kobe gets to Denver, and he goes and works out once we land, and it's like about 7. We land about 7. He goes and works out at about 9 or 10 o'clock, and then finally wants a cold tub at the end of the day once he's done. And he expects us to have it for him, right? And we were like, hey, we're not at home. We don't have a cold tub. We don't travel with a cold tub. What do you want us to do? And he had a saying, which it kind of made sense, and it still kind of made sense. And I don't know if you guys heard of it. It says, hey, don't tell me how rough the waters are. Just tell me when the boat gets in. Okay. And it's done, and the conversation is over. So now, Tim and I were like, okay, what the heck are we gonna do? We have to figure out a way. And that was kind of, again, kind of goes to kind of like the Mamba mentality, is that, hey, there's no such thing, there may be obstacles or roadblocks in your way, but you got to figure out a way to get the job done. And I remember that was one of the first things in my interactions with him, and I think Tim's interactions also with him, that it kind of set the tone for the rest of it. Hey, this is what everybody refers to as far as my mom mentality. Everybody's got to do their part, and we got to, as the trainer, strength coaches, if he wants this or they want this, and this is what's going to take for us, for him to feel better, which he's going to be the one actually performing the next day, not me, because I'm not on the court, then I got to do my job, because that's my job to get the coach up for him so he can do what he needs to do. So, okay, I was like, hey, how do you know that stuff?
Right. All right. Any other questions? No?
Let me see one.
I
How would
think-
the strength program at the
there we go.
professional level be structured, and how would it be prioritized as different stages of the season, all-star break and playoffs? Okay. So, overall, we are focusing on increasing strength and power, and especially in a sport like basketball, which involves a lot of plyometrics and a power string, and that's kind of like one of the goals that we want to try to do. But at the end of the day, our main focus is try to prevent injuries from happening. So a lot of it's going to involve mobility, stability, and strengthening the areas that are going to help kind of stable, especially the knee, the pelvis, and the ankle. Those are kind of our main priorities. But as far as during the off season, then it's a little bit different than during the in season. During the in season, we tend to do way more kind of recovery workouts, maybe high intensity, low weight, and it also depends on how many games we're having in between the season. If there's a break, there's enough time for them to be able to recover for the next game. So if for some reason there's a chance that we have like a 3-day gap that we're not doing any games, then we'll go ahead and concentrate and focus on doing some true power strength exercises or heavy strength exercises or somewhat moderate strength exercises during those 3 days. But that is rare during the season. Most of the times is more maintenance type of thing to try to maintain what they have and prevent increased mobility, increased stability in that area. During the off season, more of the power and the strength is kind of towards the beginning, which should be probably about June and July. As we get closer to the season, which will probably be in August, then we start incorporating a lot more of the power exercises, and then increase the volume, and then focus more on endurance and cardio as we get to September, going into training camp. All-star break, everybody just goes party. Everybody's MIA.
That's the Rodman mentality.
Yeah, except 2 days nowadays. Now it's 7 days. I think the break.
David, what is the difference in roles of physical therapist versus athletic trainer at the pro level? Good question. People don't know.
You know what? It varies from team to team as far as how they function. Everybody kind of gets to decide what they kind of do in the part. Traditionally, even though athletic trainers can also do some of the long-term rehab as far as either ACLs, any type of surgical stuff, but primarily I think in the NBA or in the professional level, some of the longer-term recovery injuries or surgeries are either are dealt by the physical therapist. More of the ongoing injuries or issues, so to speak, are either dealt more by the athletic trainers. But it varies from team to team depending on how they want to function, how they want to do, who wants to do what, stuff like that. And I think if you speak to each individual team, you'll find that the physical therapist role and the athletic trainer's role is going to be slightly different on what they want to do and what do they want to dictate. Oftentimes if a team travels and there's someone that's left behind because they're injured and they're not going to play, again, each team decides who's going to stay back, whether it's going to be a physical therapist, an athletic trainer, or a strength coach. And also depends on the stage of the rehab or the stage of recovery. If it's more, it just kind of fluctuates from team to team. So it's kind of hard for me to give you one answer that, hey, everybody does this, because everybody does different.
All right. Anything else? Paul, anything?
I think it was excellent. I'm grateful for you coming on and speaking to our community, coaches, athletes, friends of the community, and sharing some of the things that we all want to get back in the gym and the excitement is there, of course, but the reminder, the recovery, the work that we put in outside the gym, that we put in for the past 2 years, 5 years, 15 years, taking 2 months off, the stress and the changes of our interaction have gone to a whole new world, and us coming back and the balances of what we can work on as coaches, what we can work on as athletes, the bands and stuff that we, you know, from time to time we do them. When I'm injured or doing something, I am on the coaches about doing more band work, and then when I'm healthy, I forget about the need to do it, or bands break and I don't replace them as fast. And so these are good reminders and things that push me to do better too. So thank you for taking the time.
No problem. I'm glad to be here. Thank you guys for having me. I appreciate Arlene for inviting me to come talk to you guys.
Thank you, Marco.
If you guys have any questions down the road, a year from now, 6 months from now, be happy to reach me. You guys could reach me through, I think, my Instagram. I think you guys posted that on there. You guys DM me. I'll be happy to answer any questions, or you guys can get a hold of Arlene. Arlene knows how to get a hold of me, and we'll go from there.
We'll put a few of these things in the YouTube chat also. So we'll add, if that's all right, Marco, we'll add your Instagram handle on there. And if there's a couple links that you do share on other summaries that you do want out there that we link for others to see, we'll do it. If there are things that want to stay within the group, we'll gladly do that too. So just please address Arlene. Arlene, thank you for setting us up and always leading our community in the right way of
my pleasure.
Positive movements. It's amazing. And we have so many of us that just follow when we do have any tweak. It's like, Arlene. So, sad but true.
It's fine. That's why I'm here.
We're grateful.
All right. Thank you, everybody. Thanks,
Thank
Marco.
you so much.
We'll talk soon.
Okay, thank you.
Thank you.
Everybody
Thank you. Awesome, Marco. Thanks, Arlene. Bye.
Bye. Christina. You know, we're on YouTube Live. We should just keep going.
Oh, yeah. We should talk about. I'm just kidding.
Bye.